Good evening, all IADFE fellows. David Hexter and I, George Freedman, would like to welcome you to this very, very strange spring meeting. Usually we hold our spring meetings in some wonderful location in Europe for some fun and learning, or learning and fun, but this year, as last year, is a little bit different, and we have to adapt. So we've gotten a very exciting subject together and a very exciting speaker. Tonight, we're going to be looking at breaking the chain of viral respiratory infection. This conference is sponsored by Oral Science International, and their business includes innovative oral and nasal biotechnologies. Now, if we, let's see, I'd like to introduce our speaker, and if we can have somebody advance the slide to the next one. Thank you. Our speaker is fellow Michael Glogauer, who probably doesn't need an introduction. Those of you who were at the meeting of induction in November met him. He is the head of dental oncology at Princess Margaret Cancer Centre in Toronto. He's also professor at the University of Toronto in Canada, chief of dentistry at the University Health Network. He has both his DDS and PhD at the University of Toronto, more than 300 publications and 2 patents on topics of oral and dental health and treatment. He's a past president of the Canadian Association of Dental Research and member of the International Association for Dental Research, the Hamilton Academy of Dentistry, and a proud fellow, thank you, of the IADFE. Now, could we have the next slide before we go ahead? Are we going to take that survey now, or is that going to be done after? Okay, let's go back to the previous slide. Okay, Oral Science, I just wanted to describe the company, is an international company designed to develop and commercialize innovative oral and nasal biotechnologies that provide solutions that afflict all of us. They actively identify and bring to market efficacious therapeutics, treatments, and technologies that diagnose, treat, and protect society against viral and bacterial illnesses. And the technologies are licensed to the most capable distributors to provide the widest global availability. Let's go to the first question now. And this is an online poll, and simply touch or hit the answer to that question. Is it acceptable to go to work with a runny nose or a sore throat? So vote on that. I'm going to do it by actually pressing my answer. And here we go. On the blue screen. Okay, and now I think we're going to go to the next slide, and we will have Dr. Michael Glogauer do the speaking. Michael?
George, thank you so much for the excellent and very kind introduction. I thank you and Oral Science for the opportunity to present tonight. I hope everybody will find this an interesting and worthwhile presentation, because I think what I'm about to talk about is particularly significant for us in the healthcare field, and particularly for those of us in the oral healthcare field. So obviously we're at a time right now of where we've come through we're plus 12, 13, 14, 15 months since COVID has sort of washed up onto all our shores. And it's really changed almost every aspect of society. I don't think we can think of a single aspect of our society that is the same. And one, from a healthcare standpoint now, coughing or clearing your throat has become one one of the most disturbing things you will hear when you're in public or when you're with a group of people. And so I would say that coughing and fever are no longer socially acceptable in a healthcare setting or even in a public setting. So that is a major, major change in society, and something that we all need to be aware of. We need to be aware of when we're with our colleagues, with our friends, but also especially when we're within our healthcare environments, with our staff. You know, it used to be a badge of honor that you came to work sick, but that is no longer the case. So within our clinical settings, obviously PPE has become the standard. Walking down the streets now in many of the places where we live now, it's expected that you're going to wear personal protective equipment, including masks. As recently within, say, the last 6 to 8 months, it's been clear that all age groups are affected due to the variants of concern. So it's not just a condition. This is not just something associated with people of a certain age. It really does cut across all segments of society. And what is also being made abundantly aware is that our healthcare systems have been stressed to the point where we now can recognize that there's significant weaknesses within those systems. And so as human society does, we need to adapt and develop in order to overcome those weaknesses and those deficiencies. And I hope tonight you'll see that what we're going to present, we feel is a significant part of that adaptation. So just to sort of help put this into context, there's been an enormous global economic impact of this virus, to the point where significant costs in the billions of dollars, where nations are running up trillions of dollars of debt. Really, just to give you an example, in Canada, before COVID hit our shores, we had generated somewhere around $350 billion in debt since the beginning of time of Canada. And up to this point now, we have doubled that. And that just tells you Canada has spent more on this, trying to deal with this pandemic, than we did during the entire Second World War. So it's clear that this has been a significant impact and has really sort of damaged many economies and many aspects of society. So let's talk about what has happened. So we know that we live in a microbiome, a microbial soup, whether it's bacteria or it's viruses. They contaminate every surface. From when we wake up in the morning to when we go to sleep at night, every single aspect, every surface, everything we eat is contaminated. And thankfully, our immune system and the adaptations of our immune system allow us to really almost pay no attention to these invaders. But as we've seen, every once in a while, whether it was the Spanish flu throughout every sort of 10, 20, 50 or 30 years, we come across something that really has a significant impact, where our immune system is not able to adapt in enough time, where we start to really have a significant impact on our society. So let's talk about SARS-CoV-2. It's become apparent now that the mouth may be a key route for infection and transmission of this virus. So COVID-19 is a disease that is caused by the SARS-CoV-2 respiratory virus. And we know now that it's transmitted by droplets and aerosols. And things such as talking, breathing, singing, obviously coughing, can really aid in the transmission of droplets and aerosols. And once that virus makes its way into our respiratory tract or into the mouth, it's able to multiply there, because the saliva has some hospitable elements when it comes to temperature and moisture, and therefore saliva can play a really significant role in transmission. So again, this respiratory, we're going to talk about SARS-CoV-2, but a lot of this applies to many of the respiratory infections that really have plagued humankind since we can remember. So there are a number, there are over 200 different virus strains. They're spread by these aerosols. They make their way through droplets and aerosols, and also can come into contact with surfaces. So you pick them up off surfaces, and that's where the term fomites comes from. They can remain airborne for many, many minutes, and they are therefore able to enter the respiratory tract via the nose and the mouth. They're able to reproduce in a very short period of time, many, many, many thousands of times. The viruses will attach to the mucosal surface, they'll internalize into the epithelial cells, they'll reproduce there, and then they'll release, propagate infection, and the cycle continues. And so what we really want to try to do is, when we were thinking about this, is how do you break that chain? How are there simple methods that are available to us that allow us to come up with a preventative device that will allow us to prevent this cycle? So let's talk about the key players in this respiratory virus sort of group that really even before SARS-CoV-2 have been sort of a significant challenge for us in the healthcare field and for society in general. So there's the coronavirus family. Everybody's well aware of this, but there was SARS-CoV-2, there was MERS-CoV, SARS-CoV, the first SARS virus to hit really had a significant impact on Canada and the Toronto area in the early 2000s. We have the SARS coronaviruses also cause the common cold. We've got the influenza viruses, which we've all have sort of had our yearly, hopefully, vaccinations against. And lost and sometimes forgotten is that influenza viruses have a significant impact when it comes to seasonal pandemics. And many, many people die every year during a normal year when it comes to influenza virus. And there's also the rhinoviruses, which is the common cold, which again are a problem, and probably more also now because it ends up masking some of these other more serious viral infections and ends up confusing people, not knowing, do they actually have a common cold or do they actually have a much more serious viral infection? So the strategies are evolving. So how have we dealt with this in the past, and how do we deal with it moving forward? So really, healthcare sort of really started with sick care, where it comes for over-the-counter symptomatic management, antiviral drugs, but these have a high cost. There's an issue with drug resistance, and really have not proven to be, the gold standard on how to manage respiratory infections. We can certainly improve things when it comes to daily habits to sort of try to prevent infection, whether it's using vitamins, antioxidants, which we'll touch on in a few minutes, nasal washes and home therapies. But really, what does it really come down to when it has come to this virus? It's involving distancing of up to 2 meters or 6 feet, using PPE, whether it's gloves and masks, being very vigilant in washing surfaces and our hands, wearing protective outfits when we know we're going to be in a dangerous environment or a high-risk environment, and then also pre-procedural rinses, particularly in the dental office, have come into the forefront, although until very recently, there have not been pre-procedural rinses that have been shown to be effective from a SARS-CoV-2 killing standpoint until very, very recently, and that's what we're going to talk about tonight. So Oral Science International has come up with a novel solution to sort of try to break this chain of infection, as we call it. So the key element was to try and design a protective barrier to basically short circuit these cold and flu viruses. So the way to do this is we want to target the site of exposure, which again is the respiratory and oral epithelium. We want to try to create something that will trap, surround, and isolate the viral particles, and then also be able to neutralize or kill the virus. And so we're really going to focus in on the oral cavity and the nasopharyngeal areas, and that's what we're going to talk about tonight. So let's talk about some of the studies that have been undertaken. So our novel solution that targets the oral and nasal mucosa is, in Canada, we call it Cold and Flu Guard. In Europe, it's called Cold and Flu Guard as well. And in the United States, it's called Flavobac or Health Guard. And these are non-GMO. They do not require prescription. They have natural active ingredients. And they're really suitable for almost all ages. In Canada and the EU, it's 5 years and up. In the United States, it's 2 years and up. So what are the ingredients? So we're going to go into a little bit more detail about each one, but to sort of give you the overview, there's high molecular weight hyaluronic acid, which is a natural occurring polymer. Flavobac, which is the patented plant-based complex of bioflavonoids and antioxidants. The rinse includes glycerin, which forms a soothing film over the mucous membranes. We've got menthol, which is an anesthetic and an analgesic, and echinacea, which has also been shown to be prevent and help treat respiratory tract infections. And the concept is that when we combine these 5 elements together, we get a synergistic effect, which really provides us with a superior product, which helps us deal with these respiratory viruses. So let's talk about each one of these elements. So key elements. So we're going to talk about the hyaluronic acid. So this is an ingredient that increases the viscosity of the rinse. It helps form a barrier against the pathogens that line the oral mucosa and the respiratory epithelium. It's a lubricant, so it's a substantive film which helps keep the Flavobac, which is the bioflavonoid, on the surface of the mucosa. So it's sort of like it helps the bioflavonoid stick to the area. One of the interesting things is also immunomodulatory. So studies have shown that it can actually help prime and activate the innate immune cells within the oral cavity to help deal with the viruses and the bacteria that are present. So Flavobac, as we mentioned previously, is a bioflavonoid, and it's been proven to be very effective against respiratory viruses. It's plant-based. It comes from some Spanish oranges. As I mentioned, it's patented, and it's very antimicrobial and antiviral. So again, excellent for killing bacteria. It is an antioxidant, so in addition to killing the bacteria, it is able to scavenge free radicals that may be generated by the bacteria and or the host in response to those bacteria or viruses, which helps prevent damage to the surrounding tissues. And as we mentioned, it's an excellent broad viral killing agent. So I'm just going to go through some of the studies that substantiate what I've said above. As a scientist, I think it's always important that we are able to understand the science that allows us to make certain claims. So a number of studies have been carried out on cold and flu guard in Europe, Canada, and the United States. And all the studies have shown that there's greater than 99% efficacy in the killing of SARS-CoV-2 by cold and flu guard. In addition to SARS-CoV-2, studies have also looked at a number of other respiratory viruses, such as influenza H1N1, parainfluenza, and the rhinoviruses. And all of them have shown that this compound, this rinse agent, has an excellent spectrum and is able to kill almost all these viruses at greater than 99%. So what we're also able to show, and this is very important, particularly in the oral setting, is that this agent is able to kill the viruses extremely quickly. So in less than 5 minutes, we get this high killing potential, which means obviously sometimes for some of these agents, you can leave them with the viruses for an hour and you'll get significant killing. But with Flavobac, you're able to kill within in less than 5 minutes, and for some of these viruses, they're killed within a minute. So that's some of the efficacy data, but let's talk about the safety and the health data. So we'll just do a quick review. So as we know, we're all aware now that the human microbiome is a significant player in all our healths, that for every 1 cell in the human body, there's somewhere between 8, 9, and 10 bacterial cells present. So it's a significant and critical element in health and also in disease when we go from a healthy microbiome to a more sort of disease-promoting microbiome. So we know that the oral cavity also has its own distinct oral microbiome with over 700 different microbial species present. And that in oral health, there's a very specific proportion of commensal or healthy bacteria, health-promoting bacteria that help keep the pathogens in check. And so whenever you're doing anything, whenever you're introducing a new drug, a new therapy, a new treatment, it's critical that we show that whatever you may be targeting, when you're targeting pathogens, that you do not disturb the healthy commensals and the healthy aspect of that microbiome. And so that's something we undertook because we wanted to make sure that, especially because the Flavobac has been shown to be antibacterial, we wanted to confirm that it did not disrupt the healthy oral microbiome. And so to do this, we're able to collect the sample of the microbiome, in this case, the mouth. We're able to use something called the 16S ribosomal subunit, which is present in all bacteria, but also each bacterial species has its own specific 16S ribosomal RNA set of sequences, so that based on sequencing of all the genetic material present in the microbiome, we can get a complete laundry list of all the bacteria that are present. And that allows people to do all sorts of studies all over the body to determine what's the microbiome associated with health and what's the microbiome that is present in disease. And for example, in our case, what are there changes that occur in that microbiome when you introduce a new therapy? So there's something called alpha diversity. So alpha diversity allows us to determine changes in the diversity within the microbiome. And there's different statistical techniques used to measure that. And what we did was we took healthy subjects and we had them we collected their biofilm, their oral microbiome at baseline, and we collected it at day 3, day 7, after having them rinse 3 times a day, every day during that period. And what we can see is that no matter what statistical method we used, there was no change in the diversity of the microbiome in the subjects. So the Flavobac and the rinse was not inducing any change in the microbiome from a diversity standpoint. The beta diversity also allows us to look at the difference in the saliva microbiome amongst the 3 groups, amongst those days. And what we can see is that there was, again, no matter which statistical method we used, there was no significant change in the beta diversity of those between those 3 days. Very interestingly, though, if we looked at the individual species that are present, so as opposed to looking at the microbiome as a whole from a diversity standpoint, we started to look at the individual species. So what you'll notice here is that Porphyromonas, which is in the sort of the upper left aspect of that complicated diagram, you'll see that from baseline to 3 days to 7 days, that there was an ever decreasing number of Porphyromonas, of the genus Porphyromonas present in the microbiome of these people. So what was interesting is that while most of the bacteria stayed the same, some of the pathogens actually decreased, which is to be expected because it's been shown that the Flavobac has a significant effect from a killing standpoint on a number of oral pathogens. So this is us looking at some of the commensals, and what you'll see is as you go from baseline to 3 to 7, that's, for example, Streptococcus salivarius, which has a commensal profile. Did not change. Streptococcus mitis didn't change. So we can see that for the most part, the good bacteria, which have a positive role within the oral microbiome, did not change. What we're able to show is that when we, again, looked at specific pathogens, such as Porphyromonas, which you can see here up on the left-hand side, that it decreased as you went through, as you rinse from day 3 to day 7. Same thing with some of the Peptostreptococcus species. So we can see that for some of while the general diversity stayed the same, specific pathogens actually were decreased by the rinse. So what do we conclude? Cold and Flu Guard did not alter the indigenous commensal oral microbiota of the oral cavity. The absence of such disturbance supports the safety of cold and flu as regulatory agents view disruption of the indigenous microbiota of healthy subjects obviously as undesirable. And while there were some bacterial types reduced after using the product, these changes did not represent a major perturbation of the microbiota. So those are the studies. So let's talk about how this can be used and applied. So again, we believe that this can be used to accompany personal protective equipment, certainly while we're wearing masks and shields and gloves. Obviously, the one thing that's entering into our airways is, and when we're talking, is these potentially viral containing aerosols. And so anything we can do to protect those surfaces can go a long way towards preventing disease within the individual. So again, it can be delivered. One of the major ways we're delivering is in something called an oral spray, and it has some significant advantages. One, when you use the spray, you get excellent focus disbursement. You can target the mouth and throat, which sometimes is beyond the reach of the mouth rinse. Oral spray just, again, target the mucosa. The manufacturing advances make sure that the oral sprays are sterile until they're used. And again, they're stable at room temperature and very easy to transport. We use them in my office, and the nice thing is that they fit in the palm of your hand, so they're very easy for you to keep in a purse or in a pocket. So again, if you think you should use a mask, you definitely should be spraying with Flavobac Health Guard or Cold and Flu Guard. So as I mentioned, from the compact standpoint, you can take it anywhere you go, and that really is the key to having a product like this be useful, is to be able to use it 3, 4, 5, 6 times a day, and it allows you to really take it wherever you're spending time or coming into contact with others. So again, it's extremely easy to use. This is the instructions for the US, which you basically shake well before use. Spray 4 times to your mouth. Gargle, swish it around, or allow it to remain in place for a minute, and then you spit it out. And again, use it up to 4 times daily, or as directed by your dentist. In the EU, basically you shake well before each use. Apply 1 to 2 sprays per nostril, avoiding a deep aspiration. Repeat 1 to 2 sprays in the mouth, and then use it 2 to 3 times per day. So these products, as you can see, the product-specific information is not complicated. The active ingredients are minimal and all have significant advantages, especially when they're combined together. Again, even easier to understand instructions when it comes to the EU. But again, one of the major advantages of this is the small size bottle and the ease of use. I'd like to thank you for listening to my talk tonight, and I'm happy to continue the discussion now in real time should any of you have any questions or comments. George.
Michael, thank you very much for that very enlightening talk. And really, I'm sure as all of us, I learned quite a bit. I'm better prepared now than I was just half an hour ago, and I look forward to hearing more. Very exciting news. David Hexter and I thank you very much.